My name is Izzati Maisarah, leader of Group 7, and my teammates, which is Imtinan Aisyah, Jing, Ling, Naim, Raesul and Naufal. Today we want to discuss what news that we choose from our chosen SDG from our last video, which is SDG 3, good health and well-being, and another one SDG is SDG 4, is quality in education. News that I get from SDG 4 is Ipsos Education Monitor in 2024. The objective from this project is to give equal access in education for all students. This gives every student, even from rural area, to get the same access with city student. Other than that, always make sure update curriculum in school align with nowadays education. Lastly, to make sure all students in Malaysia get enough of technology in classrooms such as Wi-Fi, Smart TV and so on. This Malaysia Education Blueprint project ongoing 2013 until year 2025. This project involve Ministry of Education, which is Kementerian Pelajaran Malaysia, Ipsos and World Bank. In response to this challenge, the Malaysia government has been actively pursuing reforms aimed at enhance education quality. The Ministry of Education emphasised the principle of quality education is for all, striving to ensure that no child is left behind. This commitment is a central component of the Malaysia Education Blueprint, which is MEB 2013 until 2025, which focus on creating an education system that nurtures well-adjusted, morally grounded and positive contributors to the nation growth. That's all from me. My friend will present another news that we get.
Hello, my name is Aisyah, binti Muhamad Ridzuwan. So my news is SDG 4, which is quality education. So my news is about the Mukhyamantri Shiksha Gubanta Abhiyan, or what we call the Chief Minister Education Quality Campaign. This campaign approved by the Chatigash Cabinet on May 14, 2025. It is focusing on improving the quality of education in government school. It's aligned with the National Education Policy and aims to make learning more effective, inclusive and accountable. The objective of the campaigns are clear. It is to raise learning outcome, increase community participation, support the teachers' development, and ensure regular school performance evaluation. Some of the key features include: first, school will be graded based on performance. This grading system will help identify strengths and areas that need improvement. Second, regular parent-teacher meeting will be held to encourage stronger engagement between families and school. When parents and teachers collaborate, student benefit is the most. Third, teachers from low-performing school will visit successful school to observe and learn from best practices. This exposure will help them apply innovative methods in their own classes. Fourth, the campaign promotes school social audit. This means local communities and public representatives will help evaluate school performance, bringing transparency and accountability into the system. Additionally, officials and administrators will continuously monitor underperforming school and offer support where needed. This will ensure that no school is left behind. This campaign represents a major step forward education in Chatigash. It recognizes that quality education is not just infrastructure but about outcome, equity and a strong connection between school and communities. In conclusion, the Mukhyamantri Shiksha Gubanta Abhiyan is more than just a policy. It's a vision for empowering students, teachers and parents alike. It's a promise to be a brighter, smarter future for every child in the state. Thank you.
Good evening everyone. Today I will presenting on an article titled Quality Education for All, published by the Star on October 29, 2023. This initiative was introduced by Malaysian Education Minister Fadila Siddiq under the Ministry of Education. The article was published on October 29, 2023, and it focuses on effort being carried out across Malaysia. The main focus of the article is the introduction of the new concept called the Pendidikan Mahasiswa or the Humanized Education. This concept is aimed promoting equal access to quality education and aligned with the Malaysian education blueprint, specifically Shift 1, which emphasizes high quality education for all. Why is this important? Because the ministry believes no child should be left behind. Education is seen as a key tool for social mobility, helping children from poor families improve their future income and quality of life. It also about developing well-rounded, ethical individuals who can contribute positively to society. How will be achieved? By embedding the concept of human education into the ministry program, by focusing on character and value-driven learning, and by working to reduce the education gap between urban and rural areas. In conclusion, the Ministry of Education pushed the quality and human education in a step forward in making sure that every child in Malaysia receives the opportunity to learn, grow and success, regardless of their background. That's all from me. Thank you.
Hi, I'll be talking about Sustainable Development Goal 3, which focuses on good health and well-being. The main aim of this goal is to ensure that everyone has access to quality healthcare services and can live a healthy life, both physically and mentally. It covers a wide range of issues like reducing maternal and child mortality, preventing diseases, and promoting mental health. The current issues that really connects to this goal is the growing concern around mental health, especially among youth. According to a 2024 WHO report, cases of anxiety and depression have increased by over 25% since the pandemic. Despite this, mental health support is still limited in many parts of the world. This just shows how important it is to strengthen healthcare systems, not just for physical illnesses, but also for emotional and mental well-being. SDG 3 reminds us that health is a basic human right and it's something we need to keep working towards globally.
Hello, I will be reporting on a recent and important development related to SDG 3, Good Health and Well-being. On March 6, 2024, the World Health Organization (WHO) officially declared loneliness a major global public health concern. This announcement may surprise some people because we often think that of health in terms of physical illness, but loneliness is now being recognized as a serious threat to both mental and physical health. According to research shared by the WHO, loneliness significantly increases the risk of heart disease, stroke, dementia, depression, and even early death. It can be as harmful as smoking 15 cigarettes a day. What's more worrying is that loneliness affects people across all age groups. Teenagers and young adults can feel isolated even in a world full of digital connections, while older adults, especially those living alone, face a high risk of social isolation. To tackle this issue, the WHO has launched a new international commission, co-led by the US Surgeon General, to develop strategies that promote social connection around the world. This move reminds us that well-being goes beyond medicines. It includes strong social bonds, community supports, and emotional connections. If we want to improve global health, we must create more inclusive, connected societies. Thank you.
Assalamualaikum and good night everyone. Now I would like to share a few things about SDG 3, which is to ensure healthy life and promote well-being for all age. This goal is not just a slogan, it is the foundation of resilient and progressive society. Without health, every other sector, such as education, economy and society development, will struggle to move forward. However, as we work forward, we face some critical challenge. One of the major issues that our country had to face today is the immigration of healthcare professionalism, or also known as brain drain. According to an article published by Malay Mail in January 2025, Malaysia is now facing an increased number of doctors and nurses moving about in search of better pay and better working environment. This phenomenon directly impacts our ability to provide quality healthcare service, especially in rural areas. Just imagine, how can we ensure health for all if the professionalism we train with great investment end up serving other countries? If we are really serious about achieving SDG 3, we must act to address the issue. We need to reform the salary structure and create work conditions that promote a healthy work-life balance. SDG 3 is not just about building hospital or supply vaccine. There's also about care for those who care for us, which is our frontline healthcare worker. In conclusion, if we really want to Malaysia to enjoy better health and well-being, then we must start by saving and strengthening our own healthcare system. Thank you. That's all for me.